Well, South Carolina doctors, researchers, and advocates now have new hope for advances and improvements in the fight against Alzheimer's. It comes as experts say the state is reaching crisis levels of dementia, with its mortality rate 8th highest in the nation. State House reporter Mary Green explains what's sparking this optimism.
2 years ago, the General Assembly allocated $10 million in the state budget that advocates say is now funding some of the most forward-thinking dementia research in South Carolina in decades.
We have seen more outreach to communities, more education to workforce, early detection and diagnosis of mild cognitive impairments in the earliest stages of the disease, and incredible biomarker research.
That money went toward the establishment of South Carolina's first Alzheimer's Disease Research Center, a collaboration between USC, MUSC, and Clemson. Its leaders provided lawmakers with an update into their efforts Tuesday. They include identifying hotspot counties for dementia in South Carolina, seeing how prevalent types of dementia differ from one place to another, and determining how much is related to genetics versus environment. They're also working to get more rural South Carolinians into clinical trials and trying to figure out why veterans are at a higher risk for developing cognitive impairment.
Veterans deserve our special attention to find out what's going on with them.
A big challenge facing South Carolina is a shortage of neurologists. The director of this research center says they're working to empower and educate primary care physicians on how they can help patients navigating Alzheimer's and other dementia.
A large part of their practice is taking care of people with dementia. No, they don't know what the current treatments are that would be good for these diseases. No, they don't know where to refer them. They're stuck. It is up to us to be helping them out.
The researchers have been working for the last few years to get a federal designation that would be the first of its kind here in South Carolina. They say it would open even more doors for research and clinical trials, and that getting even more funding support for the state would go a long way toward that effort. Reporting from the State House, I'm Mary Green.
Mary, thank you for that report. According to the latest data, an estimated 1 in 10 South Carolinians who are 65 and older are living with Alzheimer's right now.